Welcome back to the program. We continue with some cheery news coming from Tunisia. The country has recorded no new cases of COVID-19 for the first time since early March. This is encouraging for the health authorities as the government says it will further relax restrictions on movement and businesses. The North African country, which confirmed its first case on the 2nd of March, has reported 1,032 cases in total and 45 deaths. The authorities say 745 patients have recovered and only 11 are still in hospital. Dr. Angus Ikpe, public health physician, joins us now to discuss more on the response to coronavirus. Thank you, Doctor, for speaking to us. This is good news coming from Tunisia. The authorities say no new cases have been reported since early March. What do you think the country is doing differently, and is it something other countries can replicate?
Yeah, I think the thing with Tunisia is that they started quite early, in this response. They did
All right, we'll try to reconnect with Dr. Angus. In the meantime, the confirmed cases of coronavirus in the Democratic Republic of Congo have passed the 1,000 mark, with the capital Kinshasa being the hotspot of the pandemic. Now, the virus has now spread to 7 out of the country's 26 provinces. The total confirmed cases is now 1,024, according to the health authorities, and Kinshasa is accounting for 938 cases. Both houses of parliament last week approved a second extension of the state of health emergency for another 15 days. And President Felix Tshisekedi declared the emergency on the 24th of March to curb the spread of the virus. Now, workers in Botswana have begun the first phase of returning to work after the country eased the coronavirus restrictions. Only 25% of workers are allowed to resume, and social distancing is to be ensured in all offices. High levels of hygiene is also recommended as offices reopen. The country has been on a lockdown that started in late March. President Mugwetsi Masisi extended the restrictions to the 7th of May and said resumption of normal activities would be phased. The country's coronavirus cases stand at 23 with 1 death. Well, Kenya has released 7,000 inmates in a bid to decongest prisons since the coronavirus pandemic hit the country. Interior Minister Fred Matiang'i told the Senate's COVID-19 committee that 2 cases have already been detected in a prison in the capital, Nairobi. Local media reports that the health ministry has started conducting mass testing in the prisons across the country. Kenya has so far confirmed 672 coronavirus cases in total and 32 deaths. All right, we have Dr. Angus Ikpe. He's a public health physician joining us now. Good to have you back, Doctor. I was asking about this good news from Tunisia of the country not recording any new cases since early March, and you were telling me what other countries can do to replicate what they might have done differently.
the problem is coming from. It's coming from outside. It's going to be imported. And so the first thing you want to do is, the borders, the entry points into your country. And you want to make sure that you're able to identify cases as they come. Okay, so from the airports, the most likely source of entry, you would have something like quarantine. For Tunisia, they went ahead to do a mandatory quarantine, as in, keeping people who were coming in for about 14 days, observing them strictly to see if they will manifest or if they will test positive. And once that happened, they got the cases that were coming in from there. I don't know about their land borders and all of that and their sea borders, but these are the things that a country should do very early in order to stop, because if you allow yourself as a country to be overwhelmed by cases coming in, especially when you don't know, because when we talk about surveillance, we're talking about identifying all the cases that you have as COVID-19 in your country. And the surveillance includes the points of entry where the disease is likely to come in from. So when you do your surveillance right, you ensure that you don't miss a single case that walks into your country. You'll be getting it very, very right. And of course, if you're able to do very good surveillance, identifying every case wherever they are, the next thing you want to do is isolate them and contact trace, for those cases. And if you're able to carry out this identification of cases, isolation and contact tracing very effectively, you will definitely be able to achieve what we call containment. You'll be able to ensure that you arrest the spread of this disease. Now, for so many countries, the problem has been that they were unable to see the cases as they came in. The cases went into the population and then started spreading. By the time they got to know that the disease was all over the place, it was already too late. Containment, which is identify, isolate, and contact trace, was no longer possible, and they had to start trying to make sure they could cope with the problem. And that's the situation you have in many countries in Europe, in the US. And I don't know if that's the situation we also have in Nigeria, because we're having a situation where the disease, it seems to be brewing in some states where we do not, we cannot, we're not even sure how many cases that we have in those states. But like I have always told a lot of persons that if you don't get your indicators right, for instance, the cases you're reporting, there are other ways you actually be able to find out whether you have an idea of the number of cases you may be having. For instance, nature is able to tell you that, look, something is going wrong here. In terms of the number of deaths that you have, with there's deaths that are attributable to COVID. A professor actually did report that the rate of burials had increased 10 times in a particular city, and that's an indicator that if you had 20 burials per week and you now have 200 burials per week, it means about 180 burials or deaths are attributable to COVID-19. So that's the kind of situation that actually brings you an overwhelming spread of COVID-19 in the country. So for Tunisia, I believe they took early steps, preventive actions to make sure that COVID-19 didn't turn out to be a disaster for them. And there are some other countries that have also achieved, there are quite a number, but I can just mention Cambodia. Cambodia last saw its last case on April 12th. That's a while ago. And you also have Taiwan. Taiwan on May 7th, and like Tunisia now on May 9th, they had their last case. So these are countries that have been able to, I wouldn't say, maybe the term we use is flatten the curve. But they've been able to contain the spread. Those countries.
Yes.
Yeah.
Dr. Angus Ikpe, public health physician, thank you so much for speaking to us on Network Africa. We do hope that other countries can be able to grapple with this. Thank you again. And as we end the program today in Egypt, check out this automated robotic system in a pharmacy in Cairo that's helping customers with their prescriptions for contactless purchases. The robotic device handles prescriptions, therefore decreasing human contact with medicine boxes and is curbing the spread of the coronavirus. Robotic assistants have been used in pharmacies across Europe for over a decade, and in Egypt, the device is helping limit the number of workers needed in the pharmacy. The owner of the pharmacy hopes to replicate the model that has been around for almost a year in pharmacies across the country. The device is also capable of processing a prescription with up to 5 different items, keep track of inventory, and help identify medicine with a fast approaching expiring date. Well, that's it on the program today. Thank you so much for watching. I'm Layo Adegoke.